behalf of the co-designer organizations and the steering committee, I'm really delighted to get us started and to kick off today's meeting, which is tailored to helping everyone understand the purpose and function of the network, as well as including a policy program spotlight, and that you can anticipate as a hallmark of these meetings going forward. Laura, could you advance slides, please?
Yeah, thanks, Killian. If you don't mind, as we have folks continue to join us, please go ahead and just introduce yourself in the chat. We'd love to get a sense of who has decided to join us today. And Killian, I will kick it back to you.
Thank you.
We still have quite a few people joining us, Killian, so let's maybe pause
so
for just a moment.
We're not starting. Okay,
yeah,
great.
Yeah.
Sorry about that. Yeah, I thought we were good to go.
No, that's all good. Welcome everybody who has just joined us. I think as we continue to see a few folks trickle in, sorry, Killian, let's have folks take a moment to just introduce yourself in the chat. We have a lot of people from all over the country who are here today, which we're really excited about. We'll have some more time later on to really dive into who is joining the call today. But if you wouldn't mind just sharing your name and if you'd like your pronouns as well as your organization and title in the chat, that will kind of kick off our engagement today. Okay. Killian, now I will pass it over to you.
Okay, great.
Thank you.
So again, just wanting to welcome everyone. On this slide, you can see the objectives of our meeting. It really is about introducing everyone to the Medicaid Food Security Network, its purpose, its activities, and we also want to spend a lot of time today engaging people because your participation is key to this effort. As you review the objectives, please know how excited we are to have you and including your interest and participation. And also before we move on, I want to give a huge shout out to team members from Benefits Data Trust, Health Begins, and Share Our Strength, who've done an amazing job behind the scenes getting ready for today's meeting. Next slide, please, Laura. Zoom meetings are not new for most everyone on the call today, but please be mindful of these various aspects, including that we will be using chat, not the Q&A button for your questions and comments, and also that the webinar is going to be recorded. And if there are any technical issues, our colleague Ale from Health Begins is available. Just reach out in the chat and she'll try and help with anyone experiencing tech issues. Thank you so much, Ale. If we could turn to the next slide, please. Great. We have a full agenda planned for our session today. And as you can see, the objectives of grounding in network purpose and activities, engagement, and policy and program spotlight informed our agenda. We're really leaning into the value of collaboration by offering a poll and some breakout sessions and a Q&A. So thank you for participating and setting the stage for collective action. Next slide, please. Great. This network represents collective strength, innovation, and promise to accelerate change and strengthen the ability of Medicaid systems to be a key partner in addressing food insecurity as a social driver of health. And I think I speak on behalf of the co-designing organizations that you see here. We really see this as a once-in-a-generation opportunity to define and design models to address food insecurity within Medicaid and healthcare systems. We started to lay the groundwork for this network roughly 2 years ago and spent a lot of time researching and listening. Thank you to all of those people on the call today who were part of that effort. And we learned and we know that there is lots of really exciting work happening in this space within states and spearheaded across the country. CBPP, CHCS, FIMIC, SPUR, PPRC, these are just some of the organizations making huge strides in this area of work. And this network has no intention of competing with or duplicating such exciting work in the field. Sharing, adapting, and accelerating and scaling this work is the niche we believe this network can fill. The network exists to provide infrastructure for collaboration and to be a catalyst for shared efforts for those determined by independent state coalitions seeking support and technical assistance. Share of Strength has a 40-year-old history of convening and supporting diverse stakeholders mobilized around strategies that can make lasting change in the ability of children and their families to access food resources. Simply put, we help communities feed kids and their families through grants, advocacy, and initiatives like this one, but also one that we're well known for, the No Kid Hungry campaign that promotes schools as nutrition hubs. And we are especially excited about the Medicaid Food Security Network because systems change level efforts are really needed to address food insecurity in the US. Like so many of you, I am outraged by the 1 in 5 or more than 13 million children living with hunger, especially after we saw record low food insecurity for children and families as a result of pandemic cooperation and investments. So changing this once and for all requires systems change and collective effort. And Share Strength is grateful to serve as the backbone organization capacity and as network co-designer with Benefits Data Trust and Health Begins. I'm really excited for you to hear from those other co-designing organizations too. So I'll pass things over to Kii from Benefits Data Trust.
Thanks, Kayleen. I'm Kii Powell, the Senior Policy Director at Benefits Data Trust. And I'm truly excited to be here, but also BDT is also excited and honored to be a part of this effort and to collaborate with Share Strength and Health Begins. If you aren't familiar with us, we are a national nonprofit that actually works in the multi-benefit space because we also see the need to kind of think beyond one benefit and work across the spectrum of all needs that a human may have. We actually provide enrollment assistance, submitting over 500 applications a day. And in addition to working at the individual level, we also focus at the systems level, like Kayleen was just speaking to. So we are an organization that engages in policy and practice technical assistance to states, to other community-based organizations, and attempts to support them in improving or streamlining benefits access. And we also know that we need to use research and technological advances in order to improve the application process. Finally, BDT works with other sectors like higher ed and healthcare to help enroll and connect people in those spaces to assistance like SNAP or Medicaid where that is appropriate. BDT really has a philosophy that the application process as it exists today is clunky, it's hard to navigate, and a word that or a frame that we often use is that it's not currently a dignified experience for clients. And we want to have clients who are applying for any benefit, whether that be SNAP or WIC or Medicaid, experience a process much like you or I, if we were applying for a credit card or signing up our child for a recreational activity at the local community center. We want it to be quick, easy, and respectful of their time and of the information that exists in the systems that already are there. So with that, I will turn it back to Kayleen to, I think, give it to our final speaker here. But again, really just wanted to indicate how honored and excited we are to be a part of this opportunity.
Super. Thanks so much, Key. And Rishi, if you'll just jump right in, we'd love to hear more about Health Begins.
Kayleen, thank you so much. And Key, thank you as well. My name is Rishi Manchanda. My apologies, sincere apologies for joining by phone, not being able to be on Zoom. I should be able to join by video shortly, but had some technical challenges here. I'm Rishi Manchanda. I'm CEO at Health Begins. My colleagues, Catherine Jantz and Alejandra and Kyron are all online as well. Health Begins is a national mission-driven strategy and implementation firm. We focus specifically on helping Medicaid serving clients, so specifically those in Medicaid managed care plans, in health systems, and in social sector organizations, really come together to be able to address the growing healthcare equity and social needs requirements in the Medicaid space, but to do so with a deep kind of structural understanding of what puts people in harm's way in order to drive long-term impact for people harmed by societal practices. This is an exciting time for Medicaid. In particular, as many of you know, there are increasing numbers of regulations and standards from accreditation bodies, as well as in state Medicaid policy and in Medicaid managed care contracts that now focus on not only health care equity, but also on the social drivers of healthcare, including social needs such as food insecurity. And for us, because of where Medicaid is at, and because of where organizations like Share Our Strength, Benefits Data Trust, and all of you are at right now across the country, we're particularly privileged and I think honored to be part of the co-design team, along with Share Our Strength and BDT, to be part of this broader space with all of you, because I think this is the moment now to be able to accelerate learning and action at the intersection of Medicaid policy and implementation and food security and food justice. So with that, Kayleen, thank you, and Key, thank you as well. And for everybody, we're just excited to be in the space with all of you and excited to see what we're going to be able to accomplish together. Absolutely.
And thank you, Rishi, for joining despite ideal circumstances. We look forward to having you on camera when that's a possibility. And I know everyone on the call today understands the challenges of technology and Zoom, but appreciate your everything that you've shared and being here today. Laura, can we go to the next slide, please? Great. So you've heard from the co-designing organizations, and in this slide, you can see the most active participants from those organizations over on the right-hand side, the co-designing team. So again, these are the workhorses. Extra thanks to everybody for the excellent collaboration and hard work to date. I also am grateful to the steering committee members, whom you can see listed on the left side of the screen, for their time, guidance, and expertise. They have been key contributors from the beginning, working to focus a core strategies document and also working to inform this work in general. And we plan to keep them front and center as part of this network. For example, you'll be hearing from Rich Sheward of Children's Health Watch a little bit later in the agenda. I hope that all the people on the slide are garnering lots of supportive comments in the chat, because there would be no network without them. So from that on to purpose and activities, I'd like to welcome Jamila from BDT and thank her for kicking off an overview of the Medicaid Food Security Network, now that you know a little bit about the context and the key organizations involved in setting it up.
Thanks, Kayleen,
Jamila?
and good afternoon or good morning, everyone. I'm Jamila McLean, and I'm the Senior Healthcare Policy Manager at Benefits Data Trust, and I'm so excited to be here and to be doing all of this great work and to see the diversity of folks that are with us today. Before we dive into the specifics of the network, which I know we're all very excited for, I wanted to spend a couple of minutes talking about the why. The why we have opted to focus on Medicaid and why it's important to do this work and how Medicaid can help. I see from the chat there are varying levels of expertise across many of the benefits, including Medicaid, SNAP, and WIC. So we just wanted to hone in on Medicaid as a lever for addressing food insecurity. Today, we all know that the Medicaid program serves approximately 85 million enrollees. And yes, that number will fluctuate as states are going through the Medicaid unwinding process. But of that 85 million, we know that about 34 are children and youth and 51 are adults. And the Medicaid program, by definition, serves low-income Americans and has the relationships and the communication pathways to serve them. Next slide, please. And I think when we think about Medicaid and healthcare within the U.S., there are often two very common statistics that I'm sure we've all heard repeated. And that is that first, the U.S. spends more than any other industrialized nation on healthcare and has the worst health outcomes. And second, that 80 to 90% of individuals' health outcomes are determined by the social drivers of health. So where we live, where we work, where we grow, and where we age. And we know that over time, while the U.S. has made significant strides in recognizing and moving towards a more holistic view of health and healthcare through things like value-based payments and paying for outcomes rather than services, there's more that can and needs to be done. Food and nutrition security is one of the most common social needs for low-income individuals, children, and families. And as such, reinvesting or rethinking how we pay for health is critical in meeting the needs of Americans. And as you will see on the slide here, we know that $626 billion are spent in annual Medicaid expenditures. And we can, if we reinvest just 1% of that, we can supply food for over 800,000 Americans. Next slide, please. So what is our goal? We are being very bold, and we think that we have the right people in the room to help us get there. But the goal is to impact 40% of all Medicaid enrollees, especially children and families, through improved access to SNAP and WIC and increased investments in food security and access initiatives by 2018. Next slide, please. And we wanted to just highlight the mission and vision for this work. So overall, the network is really intended to help support you all, to help support the advocates and those that are engaging in food and nutrition security work, and to help provide the services, the supports and resources needed to work with state Medicaid programs and Medicaid serving systems to adopt and implement effective strategies that support the full spectrum of food needs for children and families, with a specific focus on enrollment and on closing the enrollment gap in SNAP and WIC. As you heard Kei talk at the beginning, BDT is particularly focused on the multi-benefit approach, because we know that holistically individuals have multiple needs. And we know that the eligibility requirements for SNAP, WIC, and Medicaid are extremely similar, but we see widely varying rates of enrollment across benefits. So that's why there's a specific emphasis on closing that enrollment gap. And how we plan to do that. Our vision is really on building this infrastructure, building this network where we can provide opportunities for collaboration, technical assistance, and tools for policy and advocacy, so that we can help all of the network participants successfully identify, advocate, and implement effective state-specific policies and programs for every state Medicaid program. Next slide, please. So with that, I'm going to kick it over to Catherine to dive into what options exist for states and how we can continue to share resources through the network.
Hi, everyone. I'm Catherine Jantz from Health Begins. So excited to see all of you today. So I want to spend a minute talking about what we mean when we say Medicaid addressing food needs of children and families. And to prepare you, in a few minutes, we're going to ask you to rate how important each of these strategies are and where you think we should focus our collective efforts. In case you need a little extra incentive to pay attention to this portion. So these are the list of strategies we're seeing Medicaid agencies currently employ. There are probably other strategies, and we look forward to hearing from you about what we've missed or where we might want to add additional color. So first strategy we're seeing that's fairly common is food insecurity screening and referral. And Rich will talk a little bit more about what we're seeing in the food insecurity and screening and referral space. Second, we're seeing a lot of states invest in SNAP and WIC enrollment infrastructure and alignment in that infrastructure with Medicaid. So that includes things like streamlined enrollment processes, really clear coordination and connection points in the application and eligibility between Medicaid and SNAP and WIC. Third, we're seeing a lot of states using the assistance and navigation infrastructure that they already have, whether that be care coordination or community health workers or case management, to really support connection to food resources and SNAP and WIC enrollment. Some of the things that we're particularly excited about in this space is states that are starting to think about how do you make sure that care coordination or community health workers are available and connecting with people who don't yet have high acuity medical conditions, which includes most children. So some states are really starting to think about what are the criteria and what is the responsibility of Medicaid to engage with Medicaid enrollees whose primary need is social, knowing that over time, those social needs will become healthcare needs. Third, we are really interested into the investments that a lot of states are making around data evaluation and continuous improvement, and really creating the technology and data infrastructure to support innovation in how healthcare can address food. So that includes everything from investing in closed loop referral systems, which are these systems that allow healthcare systems to send patients to food resources and then track whether or not that connection happened and follow up if it did not. Many states are really thinking about how do you do data sharing between SNAP and WIC and MCOs and providers to really support that collaboration and coordination and whole person care. Many states are thinking about the role of quality improvement strategies to improve how we address social needs in clinical settings. And finally, some states really have a lot of clear metrics around tracking food needs, tracking resolution of food needs within their Medicaid population. The fourth strategy that we're really excited about, and that you probably have heard the most about, are investments and benefits. So these are the types of strategies Medicaid agencies are employing to really pay directly for food services to supplement SNAP and WIC and other public benefits that are available. Those include things like in lieu of services, which is a strategy that allows Medicaid managed care organizations to fund food and other social benefits, and 1115 waivers, which also allow states to include food and nutrition benefits as part of their Medicaid benefit package. I'm going to pause and see if there were questions about that before I jump to our next slide. Anybody have questions? We are going to ask you a poll question about this. So I want to make sure these strategies make sense. Okay, feel free to keep popping your questions in the chat, and I'm happy to respond via chat or in the breakout groups. Next slide, please. So our bold goal, as you know, is that those strategies be a range of strategies be adopted by every Medicaid agency. And so the way we want to do that is three main ways. First, we want to bring all of you who are interested in this together so we can collaborate and connect and learn from one another. And we'll really be looking to you for the rest of this meeting to figure out what that convening and collaboration should look like. So it's a good use of your valuable time. Second, we hope to inform and influence both all of the stakeholders on this call, as well as all of the other stakeholders that participate in making Medicaid policy through a couple of ways. So one, we will be having an email digest. So I hope all of you are signed up for our email listserv. We'll send an email every 2 months, And we definitely welcome if any of you have things that you think should be included in that email. It'll include both original blog posts that we've created specifically for this network, researching topics that are of specific interest and that we don't see other resources available in the field, as well as links and elevating other things that are happening in the space. We know there's a lot of great work happening by many of you. And so we want to use this opportunity to make sure that we're sharing that and creating space for connection and collaboration. We will also be sharing a policy spotlighter tool, which will really spotlight many of the strategies we see across the country. And I'll talk about that in a bit more detail in a second. We also will have a Medicaid 101. We know many of the people on this call and who are interested in the network have very low levels of knowledge about Medicaid. And so we wanted to create short videos, a series of short videos that you could watch on your own, as well as connections and list of relevant links and resources to really help you to get grounded in Medicaid policy. And then finally, we hope to accelerate policy change. The main way we'll do that this year is through our partners program, which I will talk about in a second. Next slide. So the policy spotlighter that will be live on our website in the coming months will allow you to filter either by state or by type of strategy. And if you filter by type of strategy, you'll be able to see all of the states where we have an example of how that is done. We are working to make sure that our examples are specific enough that they'll be useful to state policymakers and really any advocates and any other stakeholder who wants to understand exactly how another state might have executed a particular strategy. We hope that this tool really gives you a lot of resources and removes a lot of the barriers for states in adopting new strategies by providing clear and concrete examples, as well as links to the original resources, including the RFP, the request for proposals, which is the document that states use to solicit proposals from Medicaid agents, Medicaid managed care companies, as well as, formal 1115 waiver documents. Those are the documents that states submit to the Center for Medicare and Medicaid Services to request some of these new benefits. So we'll have all of those connections to those original documents so that you can learn more. Next slide, please. And then the final strategy that I mentioned we would talk about is the Medicaid Food Securities Program. So we released a request for proposals I think it was in November, and we're currently in the process of reviewing the proposals and expect to be awarding and starting the program with 4 grantees on March 1st. We received, an impressive number of proposals, and we're really excited about many of the proposals that we're reviewing. Next slide, please. And so with that, now is the time. We want to hear from you. So I'll turn it over to Laura for the poll.
Great. Thanks, Catherine. Hi, everyone. My name is Laura Cornwell. I'm the Senior Manager of Health and Medicaid with Share Strength alongside Colleen today from the Share Strength team. So we've talked a lot and shared a lot. So we wanted to just take a moment to ask you all a few questions, get some reactions to what we've shared so far. So we are going to launch a poll. Here's kind of a sneak peek of what the questions will be. Give me just a moment. And it should pop up right on your screen. And yeah, so we're just interested in where are you calling in from today? And then, as Catherine mentioned, we had some strategies that we presented. Want to get your take on those. What did we miss? And how did you even find out about this initiative? So go ahead and take just a minute or so to get that completed. For those of you who are very speedy with your poll answering abilities. You have another way that you can share some thoughts with us. What's piqued your interest so far? What's exciting about this? Hopefully something. A lot of you have shown up today to learn more about this, so we're hoping that something about this has piqued your interest. So yeah, what excites you most about participating in this network? If you don't mind sharing in the chat, we'd love to hear from you all. Yes, Grace, thanks for asking. One would be, ooh, that's really interesting. So most, let me just make sure, most interesting, and then 3 would be least interesting or less interesting. All right, we've had a lot of folks answer. If anybody feels inspired to share their excitements in the chat, go ahead and do that. I do want to let folks have just another moment to respond before we close the poll. And I am going to pass it to Catherine, just in case there's anything. I know there's a lot going on in the chat. So Catherine, anything that's kind of piquing folks' interest in the chat so far? I know there's quite a lot of conversation, which is great. We'd love to see that.
Yeah, it's exciting to see your questions and comments. And I just want to emphasize, I think Diane is raising some great questions. This is a collaborative effort. So I think not only with us, but also the field as a whole is new. Medicaid agencies are really very recently addressing health-related social needs in their programs. And so I think we need everyone's best ideas about how we can do that best and how we can really support children and families in having the nutrition they need to have healthy lives. So love all the ideas and the questions. I think it's great.
All right. Looks like we've kind of leveled off on the poll, so I'm going to go ahead and close it, and hopefully it will allow me to share the results with you all.
All right. So excited to see the diversity of states we have represented here. Looks like we have a good portion of you all, a lot of people from across the country. Okay, so I'm looking at where everyone's interest lies. It looks like, hang on, am I smart enough to understand these charts? Oh, yes, I am. Sorry. It looks like there's potentially pretty evenly split interest across the domains that we listed, with potentially slightly more interest in the SNAP and WIC enrollment and slightly lower infrastructure and slightly lower interest in assistance and navigation and screening and referral. But I'm excited to see that a lot of you have a lot of interest in all of the strategies we've noted. I think that's a good approach because for every state, we'll have different political contexts, different financial resources, and different willingness to engage in these different strategies. So I'm excited to see that there's sort of broad interest. Also excited to see that a lot of our folks from the Root Cause Coalition are here, and that some of you are connected by colleagues. All right, I think that's the end of our poll. And again, please feel free to keep piping up in the chat as you have thoughts or reflections. We are so excited to hear from all of you.
Great. Thanks, Catherine. And Diane, apologies for, surveys can be so challenging. Apologies if for not setting that up properly, but we will have some great time in our breakout rooms for discussion. So that'll be an area where we can really dive into those topics a little bit more. All right. Great. I think we're going to pass it over to Rich Sheward now, who's going to share a little bit more about policy and program opportunities, particularly around screening and referrals.
Thanks so much, Laura. It's really great to be here with you all. I'm Rich Sheward, and I'm from Children's Health Watch and a member of the network steering committee. And I'm really excited to spotlight some policy opportunities related to food insecurity screening and referral. We can go to the next slide. So as Catherine described the promising strategies framework that the network is launching, today we're going to focus on the first strategy, food insecurity screening and referral. And then in future meetings, we'll move on to spotlight the other strategies as well. Next slide, please. So when it comes to food insecurity screening and referral, our North Star is that every Medicaid enrollee is screened annually for food insecurity, and that there's an infrastructure in place to immediately address any risks or concerns for food insecurity. And unfortunately, despite earnest efforts over a number of years to accelerate the collection and sharing of social risks, including food insecurity data, we don't yet live in a world where this is common practice. And some of you might be asking yourselves, especially those from the nonprofit sector, not in the healthcare sector, why should healthcare ask about this and collect this information? And we know that child poverty has more than doubled in the last year, and over 4 million more children are living in food insecure households compared to last year. So all of our alarm bells should be going off. And screening is now a prerequisite for addressing food insecurity for families, for communities, and identifying solutions to its root causes. And if there's one thing that every healthcare provider and every community can do today, it's connect their patients to meaningful assistance in navigating benefit enrollment and maintaining access to SNAP and WIC. So that's why this really matters and what we're here to focus on today. And we can go to the next slide. So we have our North Star, and now we have to get to it. And right now, there's a lot of variation in how food insecurity screening policy actually rolls out across every different state Medicaid agency. And there's even more variation in how individual healthcare agencies and providers are implementing these screening policies. So for instance, some states require a specific health-related social needs or social risk assessment tool or a specific food insecurity screening tool, and others do not. In states that don't require specific tools, some providers are using an evidence-based screener in one location, others are using something else in another. The screening process takes many shapes. It can happen face-to-face. It can happen on cell phone, computer, tablet screens with pens and paper. The care team member conducting the screening might be a medical assistant, might be a community health worker, or might be a physician. And the frequency in which screening is performed every 12 months, every 6 months, every visit, it truly does differ. And the extent that states have put forth guidance and the extent that providers have put in the time and the effort to institutionalize these processes looks very different depending on which state you're in and even which institution you're in. States' approaches to reimbursement and financing for screening activities can vary in different ways. In some places, there are incentives, in others, there's reimbursement that takes place. And then also how screening data is managed varies widely as well. In some locations, there's no data retention at all. In others, it's recording screening rates in Excel spreadsheets. In others, it's utilizing electronic health record platforms, coding and informatics like Z codes to make informed individual health decisions and population health decisions. And the extent to which staff and providers are trained in screening best practices, providing trauma-informed care, very different. And last, I'll say there's also variation in how patients and communities and organizations that directly serve individuals and families are involved in the decision-making process and in the improvement of social needs screening. We can go to the next slide. The point that I'm driving at here is that this landscape is in a state of constant flux, And that will likely remain this way in the short term as Medicaid agencies continue to set parameters and healthcare providers implement them. To zoom out a bit from Medicaid food insecurity screening policies at the state level, I want to recognize the substantial movement towards setting screening standards, performance measures, and quality measures by national agencies. For example, the Joint Commission now requires social needs screening, including food insecurity screening, as a health equity requirement. The NCQA requires social needs screening, including food insecurity screening, as a performance measure. And CMS is implementing a quality reporting screening measure, including the screening rate and the screening positive rate, social needs, including food insecurity, which is being adopted by other programs as well. These requirements affect millions of patients who receive care in hundreds of hospitals across the country. So we're seeing a lot of action and a lot of stakes put in the ground at the national level. There's a really wonderful resource that my colleagues and friends at the Food Research and Action Center, FRAC, as well as my colleagues at Children's Health Watch through the Hunger Vital Sign National Community Practice have put together, and there's a link here and we can share it in the chat as well, that really outlines this environment if you want to learn more about that. Let's go to the next slide. So now, zooming in a little bit more, I want to share with you what we have in store. So we as a network here today are committed to collaborating with you all to inform, influence, and accelerate this policy environment around screening and referral so that it becomes part of a Medicaid enrollee's annual health risk assessment, that it becomes part of institutions' continuous quality improvement, and that broad and robust inclusion in payment models is truly a reality in every state. So this approach is going to span national, state, and local levels. We're looking to inform how the standards that I was just describing on the last slide are set and how policies are crafted by federal agencies. We're interested in influencing how state Medicaid agencies approach screening and referral through various vehicles, through 1115 waivers as one example, but others as well. And we're also looking to accelerate how health systems and hospitals, community health centers, providers implement these policies on the front lines of care. We'll go to the next slide. So I hope this policy spotlight was informative. And for those who are interested in digging deeper and learning more, there are a few resources we're sharing here. For instance, CMS has a promising practices and key insights guide coming out of their 5-year accountable health communities model, specifically on universal screening models. For those interested in various types of research, from peer-reviewed publications to webinars and guides, the Social Intervention Research Evaluation Network, SIREN, has an excellent evidence library that's updated regularly. Children's Health Watch and FRAC, the Hunger Vital Sign National Community of Practice, also has resources on our website as well. And then coming soon from the network is, as Catherine alluded to, is a resource promising Medicaid-based strategies to address the food needs of children and families, that framework. And then also the policy spotlighter that was mentioned will provide truly state-by-state analysis of these different requirements, questions you might have, and more. So there's some really great resources that are also coming down the pike as well. I'll stop there and turn it back to you, Laura.
Great, thanks so much, Rich. And we actually are slightly ahead of schedule. So if anybody has specific questions for Rich, just want to offer a moment, Rich, to put you on the spot. Hope that's all right.
Absolutely, happy to answer any questions. And I'll put my email address in the chat as well if anyone has follow-up questions.
And actually, there is a question in the chat that I think is one actually from a colleague in Colorado that I think is one you should answer, which is there a validated nutrition security screener? Sorry to put you on the spot on that one, but I think it's a good question.
No, absolutely. So right now there is quite a bit of research taking place around the concept of nutrition security. I think I saw in the participants, Chris Long from Gretchen Swanson Center is here as an attendee, and I know that Chris, you and your colleagues are working on ways to assess nutrition security. I also know that the recently established Food is Medicine Institute at the Tufts Friedman School is doing some research around nutrition security. So it's, I think, an area of fertile research, but to my knowledge, there at this point in time is not a validated nutrition security screener.
Thanks, Rich. There was quite the dialogue in the chat about the difference between food insecurity screening and nutrition screening, and whether that was in play in Medicaid policy. And I was trying to think of all the Medicaid policies I reviewed, and I couldn't think of a single one that really talks about nutrition security specifically. So if it's there, it's definitely not common. I think most of the Medicaid policy is broader strokes. And so I think this is a really important and interesting concept that we might want to introduce into how we think about our work.
Absolutely, I totally agree.
Oh, Chris concurs with you.
In all the things, Richard is always right.
Thanks for weighing in. This is the beauty of this collaborative booth. There's so much incredible people on this call who know so much. Anything else that anyone wants to voice over while we're in a big group? Questions, comments, feedback? Love all the information sharing that's happening.
Yeah, check out the chat. They're definitely coming in. Thanks, Alex, for sharing malnutrition screener and others who are chiming in now. Fabulous. This is the spirit.
All right, well, let's keep that momentum going. And now is the time that we're going to break into some smaller groups. So the way this is going to work is you've heard about our co-design team and our steering committee team. Ideally, we'll have one of those representatives in each of those groups. If not, we will ask, please designate a note taker. Ale will very kindly share the note-keeping document in our chat. But we want to just offer this. We have a few prompts that we'll share with you all, but this is your time to connect, reflect on what we've shared today. What questions do you still have for us? What ideas do you have for us? We want this to be, this is sort of the network part. This is the engagement part. So I'm going to get our breakout rooms set up while Alejandra walks through what those prompts will be, so you can start sort of thinking about them.
Awesome. Alrighty. So we're at the time where we're gonna go into breakout rooms. It'll be about 15 minutes or so. And so I don't know, Laura, if we can go to the next slide, but it's okay. You know what? I'll just voice them over. So basically there's 3 questions, with the first 2 questions really being where the juiciness is going to come into play and the conversation is going to come in here. So the first question is, how can the MFSN or the network support your organizational goals and what is most helpful to you? So what are your hopes, dreams, and desires for the network? Please share with us. The note taker will make sure to capture all your thoughts and feedback. And then question 2 is, what opportunities do you see for us to collaborate to address the food needs of children and families in Medicaid? So again, please be open to sharing anything and everything that you desire here. And so the third question is really just asking whether or not you will join us for the next quarterly meeting and what topics do you want to see on the agenda. So that's just making sure that we're creating spaces and sessions that really cater to everyone's needs, hopes, and wants. Like Laura said, I shared with you all in the chat the link to the shared Google Doc. If you have access, or if you have issues accessing, please ping me directly. You should, I think everyone should be able to access. And just make sure that you take notes in your respective row. And I think that's it. If you have any questions, feel free to chat me.
All right. My hope is that this works. If not, we will reset and come back and we'll try it again. But hopefully this will send everybody to a breakout room. Enjoy your conversations. Yep, that didn't work. So hold on just a minute. All right. Okay. Well, you get to see the behind the scenes of when it doesn't quite work. Hopefully we'll get everybody back shortly and I'll be able to reestablish them. Sorry about that. You can get a glass of water, can take a breather. And okay, I think we have everybody back. We're going to relaunch them and hopefully second time's a charm.
I was worried I was just alone. I was like, why am I in this room all by myself?
No, I think hopefully we'll be set up now. All right, thanks everyone.
Hey Laura, do you mind? Oh, I think everyone's joining back.
Hi, Mila. Yes,
Hey.
yeah, we just closed the breakout room, so welcome back, everyone. I was not in a room, but I was very excitedly watching all of the notes be generated from the conversations that you all were having. Looks like some really great conversations. And yeah, so with that, actually, if anybody would like to share anything from your conversations, certainly welcome that. We're going to get into a Q&A portion. So yeah, if anybody had anything that really stood out from your conversations, or if any of the groups had a really robust conversation around any specific topic, feel free to share that. Otherwise, we'll just open the floor.
You know, I'd love to just chime in on one aspect that I heard in our group. I think it was Megan Butler from Virginia, Food Banks of Virginia, Food Bank Association of Virginia, who emphasized it's great. We'd love to learn about what's working. It would also be helpful to learn about what's not working. What had people tried that didn't work? And I thought that was a neat take. Inviting others to chime in.
We had like maybe 3 really specific things that came out of our group that maybe the network wants to work on. One was examples of what evaluation of 1115 waiver services should look like, and really how to do that, especially for children and families, and for some of these benefits that are really more innovative. One was really some sort of really clear what should stakeholders be asking for in the implementation of in lieu of services benefits, really to make sure that, you know, small local programs that provide culturally relevant meals can be supportive and be effective and be able to you know, roll out these really exciting and important benefits. And I thought there was a third one, but now I'm looking at my notes and I have too many notes. I think that was our main.
Plug and play documentation.
What did I miss? Yeah, help me. Oh yeah, plug and play.
So very clear-cut examples that advocates could take to the states with language that could be easily put into whatever system.
Man, it looks like Jamila and Catherine got a co-facilitator. Some of us have to do it all on our own. So I was going to mention that one thing that I really resonated with me, because at Benefits Data Trust, we work you know, across the nation. And so 2 people in our group mentioned that it would be really helpful to have messaging support in places where these kinds of conversations aren't historically welcome. So really thinking about bipartisan ways of looking at this kind of approach and how we can have those conversations in different places or different states and it be just as successful regardless of where you're at.
In our group, we also heard, I just highlighted one thing, but in the spirit of highlighting a few more, we also heard about the importance and how to make sure that community-based organizations are equal partners in crafting policy and providing services, the challenges there, challenges around infrastructure, sharing knowledge and building those pathways to collaborate. And then also the importance of how are we making sure that the voices and perspectives of the people that are services are being created for are really informing that as well. So a couple of mentions about equity and that specific one about sort of community involved design, I think are helpful to lift up.
Great, thanks everyone. And continue to welcome any reflections that folks have from the entire presentation, from the breakout groups, and then if anybody has questions, is anything still unclear, or is there a specific question that you have, more technical? We have all sorts of experts on the call today, so I'm just going to kind of pause and see what questions you all have based on what we've covered today. Yeah, Megan, please.
This is a really exciting just combination of brain power here. Will there be any reporting back or out to HHS or USDA or any of the national partners that are leading some convenings and work around this topic?
Yeah, who wants to take that? I can start.
Okay, I'll chime in.
Okay. Yeah, I think we're really thinking about what our federal engagement should look like and looking to all of you to provide. We have some ideas of things that feel like might be important barriers to break down or guidance that could really reduce inequities across states, et cetera. But really lean on all of you to give feedback about where could our collective efforts be really helpful. So I would turn that question back to you to say, are there specific entities, organizations, or committees that we should be engaging and how and around what? And this is something you can answer now, or we can keep mulling over our next few meetings and engagements.
Yeah, so many of us were at the HHS Food is Medicine Summit last week and had White House commitments and have been part of those conversations too. So I think yes, and I think it's really a matter of tailoring the work that comes out of what we do collectively as a network to highlight. But there is no doubt that we have the relationships and something of value to offer back into those conversations. We just need to get this conversation going and some of those things. I mentioned earlier that the steering committee has already been very thoughtful about some strategies. We'll be bringing in a cohort of states after this quarter. And I think we're going to build some very tangible things and momentums and learnings. And then that will be a really important question to decide what and how to feature in which avenues. So it's a matter of figuring that out, not whether it's going to happen. I don't see how we could get away from it.
All right. Certainly don't need to keep anybody longer than we already have. So if you do have questions, please come off mute, enter those into the chat. Otherwise, we'll start to sort of wind down. Really hope that you all have found this to be a good use of your time. And if so, we invite you to join our next quarterly meeting. We will be hosting that on May 1st. It's the same, no, not quite the same time slot, a little bit later in the day. And yeah, our website will be the place where you can sign up for that. Please do join our regular distribution list at the same time. Keep on the lookout for our first digest at the end of this month. We have a lot that is coming down the pike in terms of updates to our website. Catherine mentioned some of those. Really excited to get this rolling. And if you have any questions, any concerns, if you'd like to talk in any more detail about what this initiative is, please feel free to reach out to me. Our colleague Audrey is on vacation right now, so she well-deserved, well-needed vacation, but she is a great resource. I also hope to be a great resource for you all. We both will receive emails at the mfsn@strength.org email address. And then for those who have asked what the website is, that is listed right here on this slide. On that website, you can find the information for joining the digest newsletter. That is, if you join the network, you'll join the digest. That is where you can register for our upcoming webinars once we get that posted, and where we will continue to populate resources as we develop them. And I think with that, I'll invite any of my fellow co-designers, if anybody has any closing remarks you'd like to share, or anything that I missed in summary.
I'm just so impressed by the group of people on this call, and I can't wait to see what we can do together. And I know it's hard to have another meeting on your calendar, especially if it's one that's not directly related to like a deliverable or something you absolutely have to get done. And I appreciate everyone coming and believing in the power of the group. So thank you all, and look forward to your input on how we can work together. And if you have
Absolutely.
anything that you want in the digest, the first one will come out at the end of February. So feel free to send an email and we can get that incorporated.
Yeah, thanks, Catherine. And that reminds me, we will send out a survey after this, either end of this week or early next week. We want to know, was this what you expected? Was it a good use of your time? How can we improve in the future? So we'll get that out to you all, and really, really hope that you'll share your thoughts with us, because this initiative will not be successful unless we are involving the right people and using your time well. So with that, I think we will go ahead and wrap up. Thanks so much to everybody for joining. Hope you all have a great rest of your day. We will share the recording, the slides, and additional ways to continue to connect in some follow-up communications. Thank you all.
Thank you.
And I suspect some of these people might have walked away from their desk. Does a host wanna, I think I'm not a host, does a host wanna end them and their participation? Do you know how to do that?